Happy New Year.
Happy New Year. Happy 2026.
Yeah, finally, here we are. Did you have nice holidays?
It was great. Yeah,
Good.
it was really good. Things kind of slow down that little week between Christmas and New Year and get to hang out a little bit. Yeah, it was really nice.
Good. Well, winter is typically a time where we're seeing a lot more illnesses. It's flu season. What are we seeing in our area?
We're seeing a lot of influenza. There's two classifications of flu: influenza A, influenza B. We're seeing more influenza A this year. It changes, each year. But the current the current numbers from the CDC is we've had about 15 million flu cases nationally.
How many?
15 million.
Wow.
Yeah, which is high. It's high. That's about halfway through the year, and so if we're tracking towards 25 or 30, this would be one of the highest activity flu seasons we've had in about 10 years. And so along with that, there's been about 8,000 deaths nationally, and 17 of those have been pediatric. So it is something to be concerned about still, and so lots of activity going on, and definitely making people sick. And the good news, though, it's not really too late to get vaccinated, and it's easy to get the vaccine. You can just go to a pharmacy, you can go to your primary doctor, and that vaccine coverage is pretty good. Flu vaccine coverage about 50%, and what that means is it reduces the likelihood of getting the flu in somebody who's been exposed by 50%. So that's good. That's a pretty effective vaccine. I got mine. I got mine back in October.
I got mine too.
Yeah.
What about flu treatments? The antivirals like Tamiflu, and I guess there's one more that I've heard is supposed to be even more effective, but hardly anyone knows what it is.
There are medications that you can take. You have to start them within a certain window. They have to start within no more than 72 hours of symptoms. Otherwise, they're really not effective. And the sooner you start, the better. I think one of the things that where folks kind of get in trouble is they'll get some symptoms. They might get a little bit of a sore throat or headache or runny nose, and just kind of attribute that to it's winter and it's common cold, and I'll just kind of deal with it, right? And it'll get better, and then may not realize that it's flu or it's COVID or it's something else. It's you don't really know what it is unless you get tested, and these tests are available over the counter, and they're very very cheap now. So I really encourage everybody, whether you go into like an urgent care or your primary doctor's office, to get tested. Or get one of the over-the-counter tests and find out, because there's treatments. You can get treated for it and reduce your risk and then risk of people around you.
Yeah, so since there are people dying, and they are dying right here in Jackson County,
yeah,
knowing what you have,
Yep.
So you can treat it makes a lot of sense.
Makes a lot of sense. Yeah, it makes a lot of sense. And
how is flu? How is it killing people?
so flu, the way that flu usually causes death is usually respiratory failure. So someone will have difficulty breathing and end up, like intubated or like a breathing machine, and end up with respiratory failure. So it's uncommon, but it is common enough that we've seen cases of that here this season in Jackson, which are pretty unfortunate, and it affects adults and it affects children. So and more on one end of the spectrum or the other. Younger kids are more susceptible, older adults are more susceptible, but it's just not really worth the risk to not be vaccinated and then take that risk on. Yeah.
Why is it? You say the worst, the highest number of cases in 10 years here in Michigan. Our state is in the top 5, and some are estimating that by the time flu season is over, it will be our worst in 25 years.
Yeah.
Why are we dealing?
That's a really good question. I think there's probably a number of variables that go into like what makes it a severe flu season or not. A lot of it is what is the strain that's circulating, and usually the other hemisphere will get the strains, before us. So each year, right, it's winter in South America before it's winter up here, and then so the strain you get that evolves there ends up finding its way up here. So a lot of the flu season severity depends on which flu strain it is, and then also a function of how well the vaccination rates are in the population, and then how well people are taking preventive measures. So all those things we learned during COVID, right, wearing masks and washing hands, also are very effective on influenza. I've seen, on airplanes again, people wearing masks, which I think is very reasonable to do when you're around a bunch of folks in tight quarters. And that's very, very effective at preventing spread of respiratory viruses.
Yeah, I think it's pretty common to see people wearing masks wherever you go.
Yep.
Basketball game, the airport.
Yeah. Yep.
The I guess confusion on vaccine recommendations.
Yeah.
And it's confusion because the state of Michigan, HHS is saying one thing,
Yeah.
the CDC is saying something else, the federal HHS is saying even something different.
Yep.
People are really, we are confused.
Yep. It's confusing for doctors too. I think that we've seen, so it always used to be the case that we would go to, the CDC would be the gold standard for vaccine guidance, and that's where the CDC would take its guidance from what's called the ACIP, the Advisory Council on Immunization Practices, and so that was a committee of really like vaccination experts that would look at the studies, understand the data, and then recommend to the CDC, and then the CDC would, generally speaking, 99% of the time adopt those recommendations, and those become your kind of standard vaccine recommended schedule. And that's pretty important, not just for for physicians, like what we would recommend to people to have, but also for insurance coverage. Insurance coverage is based on whether a vaccine is required or it's like a shared decision making. So if a vaccine isn't like a required childhood immunization, insurance companies don't have to cover it at no cost, which becomes a problem for folks that any amount of cost sharing becomes a barrier. But so now what's happened is the CDC has scaled back. Well, back in June, the administration changed out all of the members of ACIP and replaced them with what I would say are people that are more sort of politically affiliated than have like the technical capacity to evaluate the information they would need to be effective in that role. So that they made some really significant changes to the childhood vaccine schedule, and taken the number of recommended childhood vaccines from 17 down to 11, and not something that I necessarily would agree with, but those are the recommendations. So I think you're finding that doctors don't always look now to the CDC, they're looking at other expert sources that don't have the same level of political influence to understand scientifically like what is the appropriate vaccines that in this case kids in particular should be having. But the big issue with this is when those vaccines were no longer required as part of the pediatric vaccine schedule. It changes the requirement for Medicaid health plans to cover those at zero cost share. And about 50% of children in the United States get their immunizations through Medicaid. So it will have a huge impact on which vaccines are being covered or not covered for kids in the United States.
So what 6 diseases or illnesses kids will not be getting required?
Now you're testing me. So the ones that they took off the required was there's flu, COVID, hepatitis A and B, I think rotavirus, and there's one more that I'm forgetting. But so those are no longer part of like the required vaccine schedule for children.
Do these recommendations change on an annual basis? Could we see?
Not usually. Yeah, these vaccines, I've never seen it go this direction. I've seen vaccines be added. I mean, I think since I was a medical student, almost 20 years ago, we've seen vaccines added to the schedule, but I don't think I've ever seen vaccines taken off the schedule. I think this is the first time I've ever seen this happen in my career.
And as you say, political motivation, but aside from the political motivation, is there some sort of action of the vaccines or the process of vaccination that is a valid reason to reevaluate and reanalyze the vaccine schedule?
Well, the data, so the normal function of the ACIP is to do exactly that. So they're continuously evaluating data, which now is available in millions and millions of people, right? Like these have been, there's actually nothing that's been more extensively studied than vaccination. And so that is an annual process by ACIP, always looking at the available information. So if there were something that would change the recommendation or change the interpretation of that data, then absolutely it would change. But that's done on an ongoing basis, and it always goes in the direction of add, not take away, until now, right? So that alone, I think, kind of speaks for itself in terms of some of the motivation and perspective of the people that are now in that group.
Another thing that we saw from the federal government, the change in the food pyramid.
Yeah. And
one of the things that I noticed was in the old food pyramid, there was a correlation between consumption of red meat and high consumption of alcohol to cancer, incidence of cancer. That's been removed completely.
I almost don't even know where to start on the food pyramid. What I can say is that there are certain diets that are associated with longevity and lower rates of cancer, and those are, generally speaking, diets where people eat less processed food and less meat, in particular less red meat, so like a plant-based diet in particular has very positive impact on long-term cardiovascular health and long-term incidence of cancer and things like that. Very associated with a positive health outcomes. We also know definitively that high levels of alcohol intake are associated with cancer. Over a certain threshold. I believe it's 2 drinks a day. Everything in moderation is kind of reasonable. But if you're drinking at higher levels, absolutely associated with cancer, that's not really debatable. The science is not really in question there. And same thing, high levels of red meat. But there's a lot of things associated with cancer. Obesity is as well. Tobacco use, and these are all kind of modifiable risk factors we have on our lives. And but the sort of like the outside of the grocery store eating, where food is less processed, right? Kind of closer to the source and more plant-based. It is really the healthiest diet.
Well, you look fit and healthy. What do you eat?
I guess that's a fair question. I do try to have more of a less processed food, and that outside of the grocery store mentality. Garden in the summer, so it's a little bit of a bummer in the winter. It's hard to grow tomatoes when it's 7 degrees outside, but yeah, if you can grow stuff at home and eat stuff that's been processed less, I think you're in relatively good shape.
Yeah, and really, it's keep using common sense, really, isn't it?
A lot of it is. I mean, I think like everything in moderation, really, I think does go a long way. And believe it or not, I mean, almost 20% of adults in Jackson County actually use tobacco. And that's probably the single biggest modifiable risk factor in people's lives. If you stop smoking, that will measurably add years to your life. And so
makes sense.
it's hard, but it makes a difference.
All right, great to see you. Thanks for stopping in today.
Thank you.
From Henry Ford Health, Dr. Courtland Keteyian. Up next on